Hello, what a good turnout today. So glad everybody could be here. How about these companies? I'm pretty impressed myself. So my name's Robbie Allen. I'm the CEO and co-founder of Bionic Health. I've started 2 previous AI companies. The first was one of the very first generative AI companies in 2010 called Automated Insights. And now we're starting Bionic Health. And a big reason I wanted to do that was because I've become really frustrated with the healthcare experience. And to put a fine point on that, we're going to play a voicemail that I received from my doctor's office just a couple weeks ago. This was the actual voicemail.
Hello, this is at our scheduled location. A member of your family has an appointment at 9:30 a.m. with your healthcare provider at our scheduled location. If you have any questions, please call us at visitor restrictions are in place.
I mean, it's crazy, right? But that is the level of personalization you get in 2023 from one of the top health systems in the country.
I'm Dr. Jared Pelo. I'm an emergency medicine physician and built one of the first ambient AI companies. It's now a part of Microsoft, doing hundreds of millions a year. And when Robbie and I got together last year and started deciding about what we wanted to tackle in healthcare, we decided we wanted to go for a moonshot and actually work to automate a doctor. And we decided the optimal place to do that would be in the longevity and preventative medicine space. We see this as a growing market with thought leaders like Peter Attia and Andrew Huberman pushing the boundaries there. And so we built out something called the Bionic Journey, where we engage with our members and we help them optimize their health in almost every way. We collect data, lots of data, from conversations, from their medical records, from scans, from biomarkers, from everything that you could possibly think of.
And we think it's imperative that you automate the doctor, in part because of all the data that we're collecting. Doctors can't process that. You know, what we really need doctors to become are data scientists. But the problem is doctors aren't data scientists. They weren't trained that way. They don't even have the tools necessary to properly analyze that data. So at Bionic Health, that's what we're building into our system. The other big challenge is that there's a severe undersupply of doctors throughout the world. The World Health Organization estimates that half of the global population doesn't have access to high-quality health care. In America, there's 100 million people that don't have access to a primary care physician. And that's only going to get worse over time. At Bionic Health, we have a member app that our members that engage in the Bionic Journey download on their either iOS or Android, and it helps them keep track of where they're at in the Bionic Journey. So I'm showing here at the top, you know, the first bit is like, what's my current task? And at the bottom is a chat. And this is the part that we're going to emphasize for the demo today, where I can interact with my Bionic clinician. All right, so this is a chat-based interface, and this is something that most doctors tend to shy away from in the current healthcare system. In fact, it's getting to the point that in many places, you actually have to pay per message that you send to a doctor. What we're doing is going the opposite direction and encouraging people to send us messages anytime they can. How we're solving that is we're trying to automate the responses as much as possible. So what I'm going to do is I'm going to pose a question that I have, and I'll send it to my Bionic clinician, and then we'll see how Jared processes the response. Based on my cholesterol levels, should I take a statin for dementia prevention and heart health? Okay, so I just sent that in to my Bionic clinicians. A little bit behind that, so my cholesterol's been trending up a little bit over the last few years, and typically you take a statin for something like that, but I also, like, my number one thing that I want to prevent in the future is cognitive decline. I'm sure many of you feel the same way. There's kind of mixed research that says whether or not statins can actually increase the risk of cognitive decline. So as a healthcare user, I don't really know what the right answer is, so I sent this to my Bionic physician.
And as a physician, I might look at this and say, this is not as simple as it looks. You might think it looks simple, but there's a few things to remember. One is every patient is very complex. I need to know things about them. I need to go to the medical record and find out what are their cholesterol levels. What medications are they on? What allergies do they have? Do they have any genetic predisposition for this? What are the different things that go into this? And then I need to have a knowledge base. I need to go to, UpToDate or PubMed, and I need to look up what are the latest guidelines and how do I actually execute on this decision. So there's a lot that goes into even the most simple question like, should I take a statin? So what I'm going to show you is when we go into our clinician inbox, you'll notice down here that I already have an answer that's been put in there by the Bionic AI. And as a physician, I read through this, and I notice a few things. So it pulled out ApoE34. If you don't know what that is, it means that Robbie has a predisposition that's higher for dementia, not the highest, but higher than the sum. I also see that, we have to balance this with concerns of his potential cognitive issues, the cardiovascular disease, because he has higher cholesterol. So as a physician, I might say, that looks great, but my license is on the line. I need to check all those things I just told you about. So I can go into the about response here and see what the agent did to pull this together. So as I scroll down, I notice a few things, that it went to the medical record, that it looked at our clinical guidelines to build this out. So I'll see that cholesterol labs, sure enough, were pulled in, that it talks about his ApoE34, family history of dementia, and pulls all of that into one place so that when I decide to send a message back to Robbie, I feel comfortable. And of course, I can make any edits that I want to. And as a physician in the US, I only get an average of 5 minutes per year with the patient talking. They get 5 minutes of them talking to us. And like Robbie said, we're changing that because we're making this a continuous conversation, and you can only do that through AI. One of the nice personal touches that we've done is we've actually cloned my voice, so I can go ahead and send this to Robbie in my own voice.
Based on your cholesterol levels and your ApoE34 status, it would be reasonable to consider statin therapy to lower your risk of cardiovascular disease.
I just go ahead and send that on to Robbie, and Robbie has his answer.
Wow, that's pretty cool, Jared. So when did you record that? I mean, that's almost like magic, right? Actually, voice cloning has gotten really good. I estimate it's roughly like 95% quality levels at this point, and we're just a year away from that being, upwards of 100%. So I'll end with one interesting tidbit, the fact that to fly a commercial airline today, you have to use computer systems. We believe in the next 5 to 10 years, to practice medicine, the same will be true. We're raising our seed round of funding now to put our technology in the hands of more users and doctors. Thank you.
Thanks.